Now we'll talk about the causes of disease in Chinese medicine. There are internal causes, and those are related to the 7 emotions. Each of the 7 emotions always affects the liver, because the liver is in charge of the smooth flow of qi. So all emotions inhibit that flow of qi. So they always affect the liver. Why do you think they always affect the heart as well? Any guess?
Why did it affect the heart? Because the heart is simply emotions.
Yeah, but in terms of what we said, why does it affect the heart?
It's a center of
That's
our
in charge
body.
of circulating blood.
It's a center of the chi. Oh yeah.
Say that again?
The blood is commander of the chi.
The blood is commander of the qi. That's good, you pulled that out. That just means blood carries and moves the qi with it. But the reason that I say this is because the heart houses the shen, the consciousness. So the consciousness is always going to be affected by emotions. Okay. So here are the 7 emotions. We'll talk about the primary organ it affects on top of that, as well as what it does to the qi. Anger causes the qi to rise. This is why when somebody gets angry in their face will flush. Right? That's because that's the qi coming up. Whenever you see somebody who gets that way, where they get really angry and the qi comes up to the face and the head, that's someone that you want to watch carefully, especially if it happens very often, because they are a candidate for having a stroke. I'm not saying just because someone flushes that they're going to have a stroke. I'm just saying that if it happens over and over and over again, very common or very frequently, it's something to watch out for. Joy. Oh, sorry, I didn't say this, but anger primarily affects the liver. Joy, what it does is it slows the qi. It slows the qi down. That's because joy, I don't know how I feel about this explanation, but I'll give it to you anyways. It's what I've been taught. Joy expands the arteries, because joy has like an expansive feeling to it, right? You feel joyful and you feel like bigger, I guess. I don't know. But when that happens, then the blood slows down because it's not constricted and flowing through a narrow pathway. Yeah. So joy slows the qi, and joy primarily affects the heart. Worry knots the qi, gets it to get stuck. When you're worried, the qi is knotted and there's not a lot of room for things to expand. Your thinking is constricted. Right? When you're worried, you miss all of the opportunities and the possibilities of how things can work out. Worry is primarily related to the pancreas, because the pancreas is involved in thinking, as well as the lungs. And that's because the lungs house the Po, the PO, as in the corporeal soul, and worry is such a common human emotion that it affects it. It's not my favorite explanation. But shock scatters the qi. Okay? And scatters, that means your qi was normally in the center of your body and it shoots it out. And it's kind of that feeling like when you get shocked, you jump, right? And that's the qi scattering. It's shock. It primarily affects the kidney and the heart.
Can it be good to shock it if there's stagnation?
Yeah. Yeah, I mean, if you need to restart the heart, right? You use a defibrillator, which shocks it. Been doing this a lot in this lecture, huh? I'm like kind of holding my hands here. I don't know why.
It's your self-care.
Yeah. Thanks.
You're acknowledging it.
I feel better.
I get it. I get it too.
Yes. Okay. Pensiveness knots the qi as well, because overthinking is sort of like worrying. right? You're overthinking that stuff, so it knots the chi. And this is why when we meditate and we slow our thinking, that we tend to have really creative thoughts. That's because the chi is not knotted, so then it can be creative.
So pensiveness unknots the chi.
No, too much thinking knots the chi.
Okay.
So when we say pensiveness in Chinese medicine, we mean like overthinking. Slowing down your thinking unknots the chi. Sadness and grief deplete the chi. Makes the chi less. When we talked about sadness and the po last week affecting the lungs, we talked about the Charlie Brown thing, where you're like leaning over like this and you're not taking deep breaths. And then if you're not taking deep breaths, you're not creating chi, hence you're depleting your chi.
Is that the correlation between, somebody dies, you go through anger, which raises your chi, and then followed by sadness, and then acceptance, you raise up, you balance it by bringing it down, and then you plateau?
That's beautiful. Yeah, that's great. Going through the 5 stages of grief. Yeah, that's great. Love it. And so, because it's that same explanation is why it's the lung, the explanation I just said. Fear descends the chi and is primarily affected to the kidney. So, in terms of the kidney controlling the 2 lower orifices, what do children do when they're scared? They pee themselves, they pee their pants. Right? And so that's the chi going downwards. And that's it going through the kidney, because the kidney then can't hold the 2 lower orifices. Okay. So, interesting that all of the internal causes of disease in Chinese medicine are all emotions.